There is some big breaking news which is coming in. Fresh trouble is brewing for the Delhi government. Spurious drugs allegedly have been found in Delhi government hospitals. 10% of the samples from the hospitals have failed the test. The LG has now recommended a CBI probe into the entire matter. That's the big breaking news that we are getting for you here on Times Now. Remember, the fallout of this could be massive because as per the report which has been filed by the Vigilance Department, 10% of the drugs which were tested were found to be spurious. Let me go across to Niyamika. Niyamika, can you tell us what the Directorate of Vigilance has said in its report based on which the LG has recommended a CBI probe?
Well, in the exclusive copy which has been accessed by Times Now, it is being reported that there were several complaints which were being registered against the drugs which were being supplied in the Delhi government hospitals, and for that matter, the Directorate of Vigilance held certain tests for taking the samples from the 3 hospitals of the Delhi government, and these samples of the drugs doesn't found to be in the standard quality, and for that matter, the Directorate of Vigilance also held a meeting with the controller of drugs during the time of in the month of July, and for that matter, now it is being reported that the Directorate of Vigilance has mentioned that 10% of these drugs which were being tested, which were being taken from the Delhi government hospitals, doesn't come under the standard quality, as several complaints were also being registered that these drugs are not effective which are being supplied in the Delhi government hospitals. And it is being stated in this particular report which is being accessed by Times Now that the Directorate of Vigilance has mentioned that immediately the distribution of these drugs needs to be stopped, and it has also asked the Directorate General of Health Services of GNCTD to immediately stop the distribution of these drugs, and they have also asked them to do a show cause notice, to send a show cause notice to the officials regarding this entire matter, that why such kind of lapse has happened in the Delhi government hospitals.
Well, you must take us through the data because I'm looking at some of this, Niyamika, in the Delhi government labs. As per this report, it says that the total number of samples which were sent for testing was 43. The number of reports which have come in, all 43 of them have been returned. The number of samples which are declared as standard quality is 38. The number of samples which were declared as non-standard, which is NSQ, has been 5. So 5 out of the 43 samples which were being tested, which is roughly 10% of the medicines, if you, as per the Vigilance Department, were found to be spurious. And that's huge because this is a government-run, a Delhi government-run hospital that we are talking about.
Well, absolutely, and I would like to quote what is being mentioned in this particular report, as it has the name of 5 such drugs which are being supplied in the Delhi government hospitals, which have been tested by the Directorate of Vigilance, and in that particular report, it is being mentioned that any action for supplying such kind of not of standard quality drugs should not be confined to the Central Procurement Agency, and there is a need to investigate the role of suppliers who have procured from the manufacturers and provided the supply of end of users. And it has also mentioned that as many as 10% of the samples have failed in this test which was being conducted by the Directorate of Vigilance.
Sorry to interrupt you, Niyamika. Do stay on with us. First reaction of the BJP coming in. Harish Khurana, this coming in at a time, Mr. Khurana, when a CBI probe has been ordered into it by the Lieutenant Governor of Delhi as well. But this is very serious because people go to government hospitals because they feel safer there.
Yet another scam of Arvind Kejriwal. You name any department, there is a scam or a corruption happening over there. Whether it's a Jal Board, whether it's a PTC, whether it's a Sheesh Mahal, you name any department, you find some or other corruption is there. And this time, the matter is very serious because on one hand you are playing on stake is on human. Human on that. आप लोग खिलवाड़ कर रहे हो इन लोगों की जान से. And on the other hand, you are doing a corruption also. The medicines are not available. Nakli medicines मिल रही हैं. What all this? If CBI has now Arvind Kejriwal has to come forward, and their minister has to come forward and reply that. And we welcome, BJP welcomes the decision of the Lieutenant Governor of CBI probe. But always we see inquiries happening, and Arvind Kejriwal is in a denial mode or giving a self-honor certificate to himself. I mean, he always in a denial mode. But end of the day, if you see the liquor scam also, you are in a honest, you give an honesty certificate to them, but your court is not giving any bail. So truth will come out, and this kind of scam, whether you are playing with a human life, is totally, I mean, it's not acceptable at all.
Harish Khurana, the reason why all of this is very interesting is because the Aam Aadmi Party has always said that it is their education model and their health model. It is the kind of infrastructure medically that they have provided has been the cornerstone of their campaigns, not just in Delhi but across India as well.
See, both their whether it's education or whether health, both have been failed. I mean, both have been corruption. You have seen in the past that BJP has raised the question of classroom corruption in that, with construction of classrooms, is a huge corruption in that. And now in the health sector also, there's a huge scam, whether it's a mohalla clinic or whether it's a medical, these things which are coming out. I mean, they have been exposed actually. Arvind Kejriwal government has been exposed, and they were the people who used to say we are against the corruption and zero tolerance policy against corruption. But now they are Kattar Imandar. Now the Kattar Bhrashtachari has come out now.
Big breaking news which is coming in. The BJP is saying that the entire health model of Arvind Kejriwal and the AAP has now been exposed, and they are now Kattar, not Imandar as they are saying, but Bhrashtachar is what the BJP has alleged. That's the big breaking news. Thank you so much, Mr. Khurana, for joining us. Let me go across to Meenakshi. Meenakshi, help us understand these tables which are part of the Vigilance Department report that we've managed to access exclusively on Times now.
So, Meghna, we'll take our viewers one by one. We'll come back to the tables as well. You've already mentioned 10% of the drug samples found to be spurious, and this is, of course, the recommendation. And, you know, the LG at the moment has recommended a CBI probe already. Now, what does this say? It says, and this is from the LG, that it is with a deep sense of concern that I have pursued the file. I am, to say the least, anguished at the fact that lakhs of hapless people and patients are being supplied fake drugs that have failed quality standard tests. These drugs procured by the CPA, the Central Procurement Agency under the DHS, that is Delhi Health Services, had been supplied to the Delhi government hospital, and they have also probably, that needs to be confirmed, been supplied to the mohalla clinics as well. And what that has been found is that these drugs have failed and are categorized as not of standard quality. Now, the LG goes on to say, and this is the operative part, you know, that since the matter of mohalla clinic is already entrusted to the CBI, this case, which may inter alia also involve supply of the failed, not so standard quality drugs to such clinics, may also be entrusted to the central agency, especially in light of the fact that investigation therein involves multi-inter-stake stakeholders, including CPA, DHS and GNS, CTD. So basically, to simplify this for our viewers, what the LG is saying is that the fact that the mohalla clinic matter, we all know, already is entrusted to the CBI, and now the LG says that this matter should also be given to
Meenakshi, can you just stay on with us, because we want to go through the report even closely. But right now we have Piyush Joshi, a political analyst, also an Aam Aadmi Party sympathizer, joining us here on the show. Dr. Sanjeev Bagai, chairperson of the Nephron, is also there with us. I'll just come to you, Dr. Bagai, in a bit. But let me go across first to Piyush Joshi. Piyush Joshi, today the BJP says that Aam Aadmi Party has been exposed as Kattar Bhrashtachar, and this is the truth and the reality of their health model, which they tom-tom and brag about.
Well, you know, the health model is there for all to see. So that is very, very clear that the reforms have been path-breaking when it comes to the Delhi government's health model. However, if this news is found to be true and 10% of the medications are found to be substandard, then definitely an inquiry is just. And
sorry to interrupt you, but Piyush Joshi, just a quick update on this. Already the LG has ordered a CBI probe. I agree with you. These are very serious charges by the Vigilance Department that Times Now has managed to access the report of. What we are showing is a Vigilance Department report that you can see on your screens as well. And the LG, based on this report, has already ordered a CBI probe. Do you welcome the probe, Piyush Joshi?
that is right. That is right for LG to order an inquiry. Everyone needs to get to the bottom of it, because the substandard medicines cannot be given to the people of Delhi. There's no doubt about it. I am myself a physician, so I can relate to whatever concerns you are having. And it is a cause for concern. There is no doubt. But, just to paint the whole reformist Delhi model, Delhi healthcare model as faulty just based on this one thing, is, I think, a bit
It's not
precarious.
just one thing. However, it's 10% of all the samples which were tested, which is why the red alarm has been sounded. But appreciate you joining us here on Times Now, Piyush Joshi. Let me go across to Dr. Bagai. Now, Dr. Bagai, I'd like to ask you some questions that is difficult for the layman to understand. The medicines that they had tested, and I hope I'm pronouncing them right, the levetiracetam tablet, the pantoprazole gastro-resistant tablet, the allodipine tablets. These are the three which have been tested. Mostly it appears in this report that we are going through. What are these tablets? How often are they used? Are they over the counter? Is this something which is largely used by people? If you can explain to us.
Yeah, good morning.
Good
morning. I think this is quite disturbing to hear this. Even 1% of spurious drugs is unacceptable. 10% is a huge number. The drugs which you have mentioned, the first one is used for neurological conditions. The second one is what we call as a proton pump inhibitor. It's used quite extensively in a lot of patients for gastrointestinal and other conditions. And the last is perhaps what you've read is amlodipine, which is an anti-hypertensive drug. So these are extensively used. To have spurious drugs, which is of poor quality or adulterated, either one or both, in specification, is causing serious harm to patients. We know that it can not only not cause any effect, indeed it can have counter effects as being deleterious in terms of health of a patient. Especially when you're using these with patients who have pre-existent comorbidities. So the supply chain management needs to be checked. The vendor list needs to be checked. Who has approved of those vendors? Where the drugs have come from? Where is the distributor? Where is the wholesaler? The name of the companies. So very clearly, I think we need a very, very detailed probe.
I agree with you. Even 1% of drugs found spurious is disturbing enough. But Dr. Bagai, before I let you go, one quick word. It's been listed that the number of samples declared NSQ, not of standard quality, emphasis supplied, has been 10%. If you can explain what NSQ could imply for the patients.
So when you say it is not of quality, that means there is, in each of these drugs, there is a minimum inhibitory concentration which is required. The components which are required, in case there are any additives, in case there are any stabilizers, in case there are any adjuvants. So there are a lot of materials which go in to make a drug. So if any one amongst them or all of them are bad in quality or in unacceptable proportions or in ratios, then it's harmful for the body. A human body can react very, very, very dangerously, if I can use the word, if the drugs are spurious. Unacceptable. And whoever is responsible for this is an absolutely criminal offense, endangering lives of common citizens.
Absolutely. Thank you so much. This is a criminal offense. Is the voice coming in of a medical practitioner himself saying it's criminal even if 1%, forget about 10%, even if one patient's life is put at risk because of spurious medicines. That too from a government hospital. Of course, the LG has already ordered a CBI probe into it. Hopefully, the truth will come out. With that, a short break.